Welcome to Open BxRx Tuesday on BronxNet. I'm your host, Kibin Alleyne, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter and BronxNet Community Television on Facebook. In the month of November, healthcare professionals across the country are raising diabetes awareness. Diabetes is a chronic illness affecting millions of Americans, and Dr. Edwin Torres, a nurse practitioner at the Montefiore Health System, joined me to discuss the signs, symptoms, and more. Doctor, thank you so much for joining me.
Well, thank you so much for bringing awareness to this very important cause and something that affects the community in the Bronx.
Yeah, so I kind of want to dig a little bit deeper into that. But before we talk about all those facts and stuff, can you just explain, what diabetes is, if there is anybody out there who isn't sure exactly how, the illness affects your body?
So in a very simple term, diabetes, all it means is that your blood sugar in your body is elevated above normal, and your body is having issues trying to control it. So when that takes place, we call it diabetes. Diabetes in a very PG-13 version is high blood sugar in the blood.
Now, I understand that there are two types of diabetes, type 1 and type 2. Can you just explain the difference and how they affect your body?
So type 1 diabetes, it is a disease in which the pancreas doesn't produce enough insulin, so it can keep up with the metabolic demand, or doesn't produce none at all. And these folks, they need insulin in order for the body to bring the sugar into the cells. So type 1 has to do directly with the pancreas with insulin production. Type 2, it is a different type of disease. They present both with high blood sugar, but in type 2, you have different organs that play a role into the glucose regulation. Not only the pancreas, you also have the liver, you have the kidneys, and other organs that are contributing to this elevated blood sugar.
Now, I also want to touch on quickly pre-diabetes. Can you quickly let us know what that's all about?
Pre-diabetes, it is a stage in which when I look at it just like when you look at a red light, when you look at a traffic light, I mean, you have green, you can think of that as, normal blood sugar. Then you have the yellow in which your body is telling you, look, I'm having some elevated sugar, not yet to be diagnosed, please pay attention. And then the red is when we get you to a diagnosis. We do something called a hemoglobin A1C, which takes a picture of how your blood sugar has been in the past 3 months. And when we get that blood, we can see how you have been. So if you have an A1C between 5.7 and 6.4, that is considered pre-diabetes.
Now, I want to talk a little bit about the diagnosis and the genetics of it all. As you mentioned, so many people in our country are affected by this. I'm curious to know, how often will genetics determine whether or not someone is diagnosed with diabetes?
So understanding your genetic risk factor, understanding your family history is very important, especially for those with type 2. So many of our patients, one of the first things that we do is we look at your family history. And that is put into the picture of, where your current health is, and then, where you are. And that will help us create a plan as to how we're going to move forward. Type 1 is more of an abrupt, diagnosis. These patients typically, when they find out they have type 1, they come into the ER with something called diabetes ketoacidosis, and they just find out they have diabetes really abruptly.
Now, according to the CDC, and I was actually very shocked to learn this, people with less education were more likely to have been diagnosed with diabetes. Can you explain, what are some of the factors that may contribute to that finding?
So we understand that the social determinants of health play a role into your health. In the social determinants of health, you're looking at various risk factors that will put you at a higher risk for developing diabetes and other diseases. Health literacy and literacy overall, it is very important for the patient, the community to know, because based on this understanding, then you're going to make choices in regards to your health.
Now, what are some other risk factors that may contribute or cause a person to be diagnosed with diabetes?
So the biggest risk factor to developing diabetes is age. As we get older, our body also gets older. But you have some factors that you can control and others that you cannot. Those that you cannot control is getting older. We're all going to get there. But the ones that we can control, such as, you know, physical activity, nutrition, these are things that we can work on. But your zip code determines more of your health outcome than actually your genetics. So it's very important for us to be cognizant of our surroundings because based on where we live, what we have, the options that we have, then we're going to make some of the health decisions, based on this.
Now, what are some of the symptoms? I know that type 2 is the most common, so I'm going with that one. What are the symptoms in regards to that?
The most common symptoms that patients that will start to have is frequent urination. A lot of folks, they'll tell you, gosh, I'm getting up at night 4 or 5 times, increased thirst. Sometimes sudden weight loss can take place. Also, blurry vision. So if you start to have some of these symptoms, if you have a wound that is not healing as fast as it did before, we'll recommend that you come and check with your providers. It's very important to know that 34 million Americans have diabetes, and about 20% of those do not know that they have it. When you go to the pre-diabetes stage, you have 96 million Americans who have pre-diabetes, and 80% of those do not know that they have pre-diabetes.
Now, is this something that if your doctor notices it, they will let you know, or do they usually wait until it's diabetes?
So there are guidelines that we have to follow. So recently, the American Diabetes Association, they changed their guideline in which they are telling us that we should start screening patients at the age of 35. Previously, it was 45. And if you look today, even at the CDC, they still have the age of 45. So we're learning more and more as to how we can better screen patients so we can start treating them early.
Now, can you actually talk a little bit about insulin and what that does to help those with diabetes?
So insulin is a hormone that we produce ourselves. Those of us who don't have diabetes, or before you have diabetes, your body produces insulin. So insulin is a hormone that we produce. Now, when we give you insulin, it's to help you bring that sugar into the cells. So think about it as the key that helps you open the door and that allows you to bring whatever you need to bring inside your house. Because we don't want that sugar to hang inside the vascular system, because that elevated blood sugar is what gets us into trouble.
Now, there's a lot of conversation on the accessibility of insulin. Can you just explain why does this remain such a complicated, and complex discussion?
It is a complex discussion because insulin, for some patients, it is not an option. It is their life. If you have type 1 diabetes, you don't have an option of whether you can afford it or you cannot. This is something you depend on. And we have to remember that insulin is a technology that has been around for 100 years. The fact that in America today, we have folks that are struggling to get insulin, it is something that we have to look ourselves as a society and really ask ourselves, is this what we are? And is this what we want? Because we are a rich country. We should be able to take care of those folks who develop diabetes and who need this medication.
So I'm really glad that you brought it up because you brought up type 1. So insulin is for people who have type 1 diabetes, not necessarily like if you just have diabetes in general, you're going to have insulin.
Exactly. So those who have type 1, it's non-negotiable. You have to take insulin because your pancreas doesn't produce it. For those with type 2, they have, they could be on insulin. It is a medication that we use, but we have other options of medication that we can treat them with, depending on where they are in their disease.
Now, what preventative measures could be taken to avoid a diabetes diagnosis?
We always tell our patient that the first building block is, a healthy diet and exercise. So we want folks to exercise at least 3 times a week. And exercise doesn't necessarily have to be that you go to the gym. I tell my patients, if you take the train, try to walk to the next stop, if not the following, because this is physical activity that you are incorporating into your lifestyle. If you live in a walk-up building, try to walk up, a few times and skip the elevator, because the more physical activity we add, the more demand we create for our body, and the more that sugar gets utilized, so we can keep those numbers controlled.
Now, I want to focus on New York a little bit. According to NYC.gov, African Americans and Hispanic/Latino Americans are amongst those who face a very high risk of being diagnosed with diabetes. Can you just talk a little bit more about that and explain why we're seeing this pattern?
In general, African Americans, Latino, they tend to live in communities that are disadvantaged. They are deserts for food, they are desert for walkability, they are desert for having access to physical facilities. It is very important to know that if you are of Latino, you are African American, you tend to be diagnosed at a younger age. And also, the disease is a little bit more aggressive. So it's very important for those who are in this high risk category group to pay attention to their bodies and follow up with the providers, so we can avoid later on some of these complications, because we can perhaps prevent or delay the diagnosis of diabetes.
Now, as we mentioned, literacy and just education is just so important in regards to our health. And I know it's something that a lot of people of the Bronx can definitely benefit from. Can you just let people know how they can get tested and, just how they can learn more about diabetes?
At Montefiore this month of November, we have a full calendar of events. And please go and check us out at montefiore.org/diabetes month, in which we will be offering free educational courses for the community. But you can also access the Department of Health or the CDC to get reliable information. I want our community to understand that many folks are preyed upon from unreliable sources. So please go to the Diabetes, Association, or the CDC or the Department of Health, which are reliable sources to get information about diabetes.
All right. Dr. Torres, thank you so much for joining me.
Thank you for having us. I appreciate it.
We'll be right back with more Open BxRx Tuesday.